We are auditing aggressively, and we don't like what we see.
In March, the Trump administration began auditing states that provide illegal immigrants with routine health care paid for by American taxpayers. Their findings? 7 states and the District of Columbia owe nearly $1.4 billion for using federal, not state money for immigrant care. Topping the list, California, followed by New York and Illinois.
In California, we've already identified about $1.3 billion of federal dollars spent to take care of illegal immigrants.
Under the law, states can only use federal money for migrants' emergency care.
When you come for elective hernia operations or dental cleaning, that's not going to be paid for by the federal taxpayer. It's not right. You don't want folks in one state paying for people in another state without them knowing about it and voting for it.
California says claims it did anything wrong are, quote, flatly false, saying the state routinely reimburses the feds.
Universal health care for all, regardless of pre-existing condition, regardless of the ability to pay, and regardless of your immigration status.
After extending care to its entire undocumented population, rising costs forced California to impose premiums and stop accepting new patients. Other states facing rollbacks? Colorado, Illinois, and Minnesota, either cutting subsidies or dropping adults altogether.
It was cruelty dressed as fiscal responsibility. There is no other outcome for when you take away people's health care.
You hear 2 arguments. Some will say the immigrants are already here, most are working, and it's cheaper to provide them coverage under Medicaid than the emergency room, while others say stop the handout. If Americans can't afford health insurance, why should they pay for it for someone else? Well, each state answers that question, albeit without federal money. In Los Angeles, William Lajeunesse, Fox News.